Good afternoon. All right, let's get underway. It's our final panel discussion for the afternoon. So thanks for your attention. I think it's a really important topic. So several of our grant awardees target populations with unique cultural needs. They realized that their program delivery needed to take into account cultural norms and expectations in order to promote successful health outcomes. So our panel today will highlight two organizations that have taken the innovative approach of providing culturally sensitive program interventions to maximize participant outcomes. We'll learn more about the programs they are implementing to improve heart health, as well as their effective practices, lessons learned, and challenges in these scenarios. Our discussion portion will provide an opportunity for each of our grant awardees to receive real-time feedback from their peers and to take questions. So I'd like to begin by introducing our speakers in the order in which they will be speaking. First, we have Lisa Stefanelli, Executive Director at Westminster Free Clinic in Thousand Oaks, California, here to present on the Corazones Sanos, or Healthy Hearts program. The Westminster Free Clinic has received 4 years of funding from the AstraZeneca Healthcare Foundation. Our other panelists are Chad Mender from the Mid-Valley YMCA in Van Nuys, and program partner Barbara Gonzalez, program coordinator at Dignity Health Northridge Hospital Medical Center, to present the Activate Your Heart, Activate Su Corazon program. The Mid-Valley YMCA has received 3 years of funding from the foundation. We're also joined once again by Dr. Jim Blacetto, our board chairman here at the foundation, who will also serve on the panel and provide the viewpoint of the foundation. So let's begin. So our first presenter is using a culturally sensitive program approach to improve the health of low-income, uninsured Latinos suffering from or at risk for heart disease and/or diabetes in Ventura County, California. So here to tell us more about Healthy Hearts program is Lisa Stefanelli, Executive Director at Westminster Free Clinic. Thank you, Lisa.
Thank you so much. So I'm really excited to share with you today some of the information about our program. Our population in Ventura County actually is larger than the total population of the state of Delaware. And so, and within that, our Latinos have 19 years less of life than the rest of our population in Ventura County. So our Latino population is very low income. They average income is $25,000 a year or less. They're the working poor, so they're not eligible for free, affordable care, and they can't afford to pay for it themselves. So that's our target population. We are a public health model, medical model put together, and we address the 5 social determinants of health as we look at changing the built environment, the social systems change. We have access to care through volunteer medical professionals. Over 108 different doctors, podiatrists, ophthalmologists, dietitians, others volunteer their time. And we provide all of our services free of charge, so access can be obtained early. And we also have individual activities as well as social, emotional, and social economic factors, which are all part of our approach to providing a really robust way of helping address the health care for health improvement of our Latino population. And with that, one of the most important parts of our program that makes us quite unique is we have 54 high school students from our patient population who are Latino, who are bilingual, who are first-gen students to go to college, to even finish high school in our community. And we have them as part of our team on all aspects of our Corazones Sanos program, even our medical component. They are the ones that serve as medical assistants at our clinic. And at the end of their graduation, they can be certified as a medical assistant through a partnership we have with the state of California. And we also help them go to college. So we have typically every year about 100% going to college. This last year we had one student who wasn't able to go, and we have one student join the Marines. So, but typically our students are all accessing healthcare and of course 100% on scholarship. with that, I'd like to start by saying this is a patient. If you look in your package to our poster session, you can follow along there, which is very visual and graphic. But this woman is in the poster session as well. But she is one of our 3-year graduates. She's just signed up for her 4th year, and she's been one of our poster children. Her mother died at 49 years of age from complications with cardiovascular disease and diabetes. And when she was diagnosed at 45 years of age with diabetes, she was really scared and thinking that her future was going to be dying like her mother. Through the program, she immediately got involved in all the aspects of our program. So she got on diabetic meds, which we provide for free. She sees a doctor in our diabetic clinic regularly, and dietitian, podiatrist, all the specialists, but she also participated in all of our other Corazón Sano's program activities, which includes health education, health literacy, it includes art therapy, includes a grief and loss class called Sano, Start Again, Not Over. It includes Zumba and yoga. So when she came, she took advantage of all those different activities, and she took her A1C levels from a 9.6, and she's now down to 5.8. And so she's been able to sustain, and what we look for in our program to consider ourselves as successful is that our patients are able to sustain change over a number of years. If they just lose their weight for a while, or they improve their labs for a while and then go right back up, that's actually really hard on their bodies. So we're really looking for sustainable change. These are the students I was mentioning. So we have 54 of them that actually help run all our programs here. They're running a Zumbathon for us for our patients. And they design the shirts, they put the whole event on together. They're learning those heart health messages too, and then sharing them with their families, and we do evaluation and find that they've made lifestyle changes themselves. These are some of our graduates who are now in college. The student on the far left, she's finishing nursing school this year. The student next to her, Jennifer, she is getting her degree in public health. Belen is actually getting her, is actually one of our running our programs. She started getting her undergraduate degree and now is getting her master's in public health. Cassie is on our board of directors. She graduated from her teen intern program, and then she's now at college planning to go on into nursing. And we feel we need a student as a spokesperson on our board to speak on behalf of our student interns as well as our patient population, and all of our members come from the patient population. And then a student on the end is also in college right now. So they're all going to hopefully go on to be great health leaders in our community, and there's a real shortage in California of Latino healthcare providers. So you can see our outcomes are impacted by the participant improvements. Here you can see that new means they've completed a full first year versus those that are just signed up to start their 2nd year. And this right here shows you the 2nd and 3rd year participants, how they've been able to maintain change. And again, for us, we feel you need to look at longitudinal, sustainable improvements. And you can see in all areas with the glucose and HbA1cs being the most challenging, that we're able to get them into the good levels, but really big improvements in all of these others. The blue line shows you where they should be, here or below, or HDL there or above. So that, just so you know, what the blue line represents your where you should be at. So how do we overcome challenges? We have challenges where, I don't know if you guys have this, but telephones. We have telephones changing all the time because some months they have enough money to pay for a phone and some months they don't. So it's really, really a tough situation to follow up, and we do follow up and call our patients. We do a lot of one-on-one support as well as group programming. So telephones are a big challenge for us. We found childcare was a big challenge for us, so we started a childcare program. Transportation, as others have mentioned, for us, everything needs to be in Spanish, and most of our population is very, very low literacy. The person that you saw a picture of earlier with all those successes, she was a nanny. Most of our patients are domestic caregivers for the elderly, for families, for children. They're gardeners. They're doing jobs where they can't afford. They're insured and they don't have access to health care. So we have to come up with programs and approaches that really work for them. We found a lot of our patients have a lot of anxiety and stress, so mental health is a huge part of our program. That socio-emotional health is key, because if they're really stressed because they had a death of a loved one and they never knew how to deal with it, it's really hard for them to think about losing weight. because they're still grieving or they're still anxious about other losses in their life. And so we have mental health counseling for free, as well as the group program I mentioned, Start Again, Not Over. We have the vision boarding, where they create a vision of what their life is going to look like when they're healthy. And then we also have art therapy, where volunteers come in and do art. And our patients have never done art before in their life, so it's really cool for them. We give out free fruits and vegetables. We have a food bank that provides those for us. So we bring everything to the patient. And one thing that's really important about our program is we're reaching a population nobody can figure out how to reach. So everybody wants to partner with us. So we've got hospice groups, we have the food bank, we have the county, we have everybody who wants to bring their services to our clinic and when we're doing our programs, because we've reached a population that they want to also reach. So we have access to healthy food as part of our effective practices. We have the Healthy Hearts Kids Club, that's what that stands for. And so we found that that was a gap. We really needed to provide childcare if we were going to have parents be able to come and be a one-stop, where they could get their medications, where they could at the same time go to Zumba, yoga, our Corazón Sano's healthy programs, try our food tasting. When we could bring in Brussels sprouts, our Latino population's never eaten a Brussels sprout in their life. And so we needed to have them taste them and see a healthy way to eat them and see that they really tasted great. And then they all took them home, and it was really positive, and we didn't get stuck with a bunch of Brussels sprouts at the end of the night. The Zumba's on, you can see down there, we do Zumba in our room every night. We do the one-on-one counseling. We do pre and post evaluations one-on-one. Because our population is illiterate, we actually have to read the questions to them. We have the Likert scale, and then they circle where they are on the scale, but we have to read to them. These are some of our fantastic students. They're all in college now, I'm happy to say, and have scholarships. One's at the University of Maine. If you can imagine going from Southern California to an hour from the border, she's having a whole new experience. She's doing really, really well. Our Latino markets are our partners in 5 cities. So we actually see that the markets need to be, the community needs to be a part of the solution to support. We can tell people all day long to eat healthy, but if they go back and there's only fried foods, it's not going to be possible for them to eat healthy. What we found with the markets is they weren't as cooperative with us as they were with our teams. Our teams do all the outreach with us in the communities, and the teams were friends with the owners of the markets kids. And so they were able to get our markets to work with them through the children. Also, we made it business friendly so that they actually felt they were going to make money, because we were going to drive business to their markets and advertise their markets for free in exchange for working with us. So youth and community engagement are super important. Our lessons learned is to include the 5 social determinants of health as you think about a program. You need access to health care. You need the individual component where people are having a 21-day challenge and having goal setting and food tasting and all those things. You need to also have a component where you have the socio-emotional, socioeconomic considerations, and you also change the environment. And you want to have economic instability is our biggest barrier and challenge for our population. So anything where you can help them economically, you're going to get them to come to you. You're going to also have them participate in your programs long term. We learned the biggest thing, we had problems with labs, and we were going to tell you that was our problem. We don't have that problem anymore, because we just, for the holidays, said if you come back to get your labs done, we'll have your family adopted for the holidays. We have all these community groups that want to adopt our families because they know we screen them and they know they're low income, and everybody came. So it was amazing. We finally figured out the formula. So engaging youth and adults and empowering, helping the community is really important. It makes it sustainable. Also creating a Healthy Hearts Kids Club achieved 2 objectives, because we have children who are learning heart health messages the same as their parents through the club, as well as the parents can participate. But our biggest lesson learned is the socio-emotional health, that when they feel loved and cared about and safe, they will come. One thing that makes us successful too, we don't ask for a lot of private information. We don't need to know, we're free. So then they feel safe to come. So if they're a mixed status family, they don't worry, because they know that we don't have any information. And then having a team of bilingual professionals who are culturally sensitive, caring, and compassionate. Just speaking Spanish is not enough. They need to really care and love the very low-income population, and that's often forgotten, that language is not enough. So that's really, really important that they're caring and compassionate. And our biggest challenge, of course, is budget, like everybody else, trying to keep it all funded and paying and keeping everything free so everybody can participate. Also, we found grocery gift cards and all that really matter, and teen stipends so the parents will allow their children to volunteer is super, super important. The poor are getting poorer. That's what we find in our area. Everybody's working multiple 2 or 3 more jobs now, and like I said, I would have said labs, but I think we solved that one. And access to affordable, healthy food and exercise options where people work and live. So thank you very much, and thank you. Thank you.
Tour de force, as always. There's so much. I wrote down like so many questions as you're going through that. We'll come back to it when we're on the panel, but thank you so much. So our second and final presenters for the session have used a culturally sensitive approach to help low-income Latinos in the San Fernando Valley in California improve their knowledge about cardiovascular health and develop healthy behaviors. Here to present the Activate Your Heart, Activate Su Corazon program, our Mid-Valley Family YMCA Executive Director, Chad Mender, and Dignity Health Northridge Hospital Medical Center Program Coordinator, Barbara Gonzalez. Welcome.
Good afternoon, everybody. Last session, here we go. First of all, I want to just give a shout out to Lisa and the Westminster Free Clinic. Last March, we actually got to go out there and actually pay a visit. They're only about 45 minutes away from us, and they literally transform a church into a full-fledged center, and it's so impressive, and it's super motivating. So congratulations on all your great work. First of all, I just want to start off by introducing myself. My name is Chad Mender. I'm the Executive Director at the Mid-Valley Family YMCA, and joining me today is Barbara Gonzalez, one of our community partners, the Center for Healthier Communities at Dignity Health Northridge Hospital. The Mid-Valley Family YMCA, we are one of 26 YMCA branches, a part of the YMCA Metropolitan Los Angeles, and our three core areas of focus are youth development, healthy living, and social responsibility. So I couldn't think of a better subject matter than cardiovascular health for a field for us to work in. So with that, I'm going to turn it over to Barbara for our first slide.
Thank you. Okay, perfect. So before I go into our cardiovascular health need, I want to paint you a picture of the community that we serve. We are in the San Fernando Valley, north of Los Angeles, and to be exact, right now we are surrounded by the fires that you've been watching on TV. We have these are the statistics from Department of Public Health. We have 2,228,821 in the San Fernando Valley. So we're pretty big and heavily dense and populated. The participants that we serve, a lot of them, there's 2 to 3 families living in one single apartment or 1-bedroom apartment. They don't have access to health care, and they're predominantly Latino. And we have 23% of adults have been diagnosed with hypertension, and 1 out of every 4 of adults have high blood pressure. As preparing for this, one of the things that was a little shocking is that 118.5 out of 100 die of coronary heart disease in the San Fernando Valley. This translates to about 2,600 people dying of coronary heart disease. And so with that in mind, when we wanted to create our program, we want to improve the knowledge about cardiovascular health and make those healthy behavior changes. We want to move upstream and really stop, prevent from up here the onset of cardiovascular disease. And through that, we have created various strategies to address that I'll be talking in a little bit. And part of our goal is as well to partner with 2 neighboring YMCA branches, expanding our efforts to about 4,000 new households. So Activate Your Heart, Activa Su Corazon, it is a 10-week program. We meet once a week for 2 hours a week. Our staff is bilingual. And they're cultural sensitive, but they also live in the community, and that makes such a big difference. Not that they know the needs of the community, but they also know the resources that we can provide our participants. And we utilize the American Heart Association Empower to Serve curriculum. It teaches about
what is blood pressure? It's basic enough for our population, but it gives a lot of information in terms of what is blood pressure, what is, the signs of a heart attack, what are the signs of a stroke, talks about the importance of physical activity, nutrition, and even the impact of smoking on the heart, on cardiovascular health. And we also use, we do food demonstrations. Those are very important. We use quinoa salad. We use, I was sharing with the group earlier, we call it our Susketti. We have this gadget, it's like a Veggetti Pro. So we put different colors of zucchini, and then we create like spaghetti. And we add herbs and marinara sauce, and we provide that to the as tasting to the participants. And we also raffle the ingredients and the Veggetti Pro, so that's a great incentive for participants. We also, once we cover the nutrition component and the nutrition label, we take our participants in a field trip to a local market. Our goal is not to tell them, okay, eat these or use this brand instead, but to teach them how to read the nutrition label. To a lot of them, that nutrition label, even to me, before I knew how to read the nutrition label, it was like French. You see percentages, and what does that mean? Is that good? Is 4 good, 4% good? Is 20% bad? What is that? So our goal is to really educate and provide them the tools so they can choose better and healthier products for themselves, also based on their budget. Part of the program, very important, is our physical activity. Our physical activity we have done from Zumba, that's very popular with the moms, with other population, older adults, they may prefer a little something more like yoga. We've done chair exercises, Pilates. So our exercises are modified to the needs of our participants. And very important, as far as evaluation, we do the first week and the last week of the program, the 10th week, and 3 months post, we do screenings. We do total cholesterol, we do fasting glucose, body mass index, and so those are some of them, and blood pressure. And as we know, childcare can be a barrier, so we provide free childcare, so the parent can drop off their child at the program, and they can go and then engage, be fully engaged in the program. And a great incentive is our free 3-month membership once they complete at least 8 out of 10 weeks. So a lot of our participants, when we talk about, the YMCA, they think of a song. So it's like, no, it's a great facility. So this is their first time, and this helps them continue their journey to health.
So we've actually, just this last week, we've finished some more sessions. So this number is actually updated. We've actually engaged 669 participants in our program and tracked 432 participants. We're offering this program in a lot of different locations, obviously the YMCA, other neighboring YMCAs as well, local community centers, schools. We even have offered it at a one-stop shop homeless service center, which was very, very effective. But this is just one quick quote from Maria Greenwood, but we have so many success stories. We're really, the grocery store tour experience is really kind of an aha moment for a lot of our participants where now they feel they can shop more with confidence. Shopping on the exterior of the store is really where they need to be for all those fresh produce items. And just a few things about sustainability and dissemination. We're doing a Train the Trainer model on January 20th. We're going to be hosting a training to engage other local YMCAs, schools, parent centers to come out and learn about the program. We are in the process of writing about 6 articles that will disseminate in various platforms, whether that be email blasts, newsletters, some local Spanish-speaking publications as well, newspapers. We are also in the process of developing a toolkit that we will be, we just actually received word the last couple of weeks, but we will be showcased at the Y of the USA's Program Expo, which happens every 3 years, where 2,000 YMCA professionals come to Denver, Colorado, and we'll actually be distributing and sharing our information about our Activate Your Heart program. So we're very excited about that.
So some of the challenges, just like with the other organizations that we have heard today, is recruitment. Also identifying the correct program hosting site for our program since we go into the community, and identifying the correct screening partner. To address these challenges, like for recruitment. One of the things, once we secure a hosting site, we go into the community, we do a windshield survey. We have a list of 40 to 60 agencies like school, childcare, libraries, clinics. We contact them directly and let them know about our program. Perhaps we can either go and promote the program at their facility or at least drop off flyers. We also partner with the clinics, as I said before, and their physicians are referring participants into our program. Another thing with the hospital, we have a care coordinating team, so they are also referring participants, patients into the program. Another thing to identify the program hosting site. When we meet with the site, we have a checklist. We go over, like, do they have the adequate space? What is their program implementation? Any requirements? We want to go over everything in terms of, their support for our program before we actually schedule a workshop at the site. And lastly, with any program, it is important to do program improvement. And as we were doing our program, we found some challenges with the screening partner. So we changed screening partners. So as we know, sometimes we schedule a program and not last minute, but maybe a couple of weeks before, we have to change times. So it is important that that our partners are flexible.
So just a few lessons learned. We've kind of learned that we have probably about a 50 to 60% dropout rate. Pre-register 2 to 3 times the amount of people that we really want to have in our session. Really incentivizing our participants throughout the course of the session, things like the Veggie Pro. We even do a perfect attendance raffle at the end, where we actually raffle off a smoothie blender that we use throughout the session with fresh fruits. But really what it comes down to is building those personal relationships. It's about trust. It's the relationship. If they miss a class, do we reach out to them and say, hey, where have you been? We need you there. So that there's that accountability piece, that they know that they've made a friend, they've made a connection with the program. Some of our current challenges still are around retention, tracking, getting them back for our 3-month follow-ups. We offer Target gift cards, et cetera. But then also just lastly, as we try to sustain and spread, getting other agencies and other YMCAs to get on board and see that, cardiovascular disease is an important thing, and we really need to work together to bring about change in our community. So thank you.
Thank you.
Thank you very much. So many of our programs target low-income, underserved populations. I think all of them do, actually. And each community faces its own unique barriers to health. And you've mentioned some of them, whether it's child care, whether it's folks have to work 2 jobs, transportation to where you are. So can we spend a few minutes just talking about barriers and maybe what your organizations are doing just to help get people in the door, as you're just talking about, Chad? Like, there's so many reasons for people not to show up and do it. What are some of the things you can do to help take down the barriers?
Well, I think first and foremost, just make it as easy as possible. So, bringing together trusted leaders. So whether if we're offering the program at a local school, so it's leveraging the parent center director, leveraging the principal. So it starts with that figure in their life that they know to start a relationship with us. But also just like eliminating all the barriers, providing it at an adequate time. So maybe it's right after we drop the children off for school and it's right there at the school property. Providing access to a free membership to the YMCA after the program's over to continue on their wellness journey. So there's a lot of different things where we can just provide no excuses for them to not do the program. Yeah. Lisa?
I usually say that you have to make the right choice, the easy choice.
Yeah.
So going out into the community where people are already working or shopping is really important. Making it a one-stop, so when they are taking that time off from work, they can get everything done at once. So depending on what they value, they'll come for that reason. Also just making it, as Chad said, at times that really actually work for them. So after their work hours, or even if it's late at night, or whatever you need to do to make sure that they can come.
I know you talked about that, Chad, when I came out to visit the YMCA, and it's the same thing at Manna Ministries too, where there are so many things that are offered. Someone may come in for Alcoholics anonymous, and then they'll see this program and stay for that, and then another night they'll come back and there'll be a literacy course or a financial literacy course. You just, whatever kind of traction you can get to keep getting folks in. And Lisa, you'd mentioned maybe not a barrier, but a contributing factor is not as many medical professionals serving Latino community or speaking Spanish in California as are needed. And you talked a little bit about some of the students and volunteers who are gaining a medical certificate. Can you talk a little bit more about that? Because that seems like you're a win-win.
So yes, I think this is fun. But I think when I said that there was a shortage, it's a shortage in the paying community. So for as a whole state, the medical professionals who are physicians and other practitioners who are Spanish speaking do not reflect the percentage that are Latino in our state.
Right.
It's like 1% in Ventura County compared to 48. I think it's like 48% Latino.
Okay.
So with that, our high school students who are from our patient population, as they help others and they're part of our Corazones Sanos program, they start believing, my gosh, I can do something. I can make a difference. And then they start thinking, oh, if I go to school and I study hard, maybe I can go to college too and do something like this for my future. And so they start dreaming bigger dreams. And then they see us helping students get scholarships, and then they realize maybe their parents have said, oh, we can't afford it, and they realize that might not be a barrier anymore. The clinic may help them. And so it is a win-win because we're shortening the line for the next generation, right, where they will be insured and they will have access. They will know how to eat healthy. They'll have access to health care. And that's a really important social determinant of health is education and access.
That really struck me just as you had that photograph up of this kid went to college, this kid joined the Marine Corps, this one's going to nursing school. Yeah. Like, whoa,
it's just changing their whole future. Yeah. They're not cleaning houses,
yeah,
which their parents don't have many options, but they will now have options.
Yeah.
Don't underestimate the utility of children in the family or outside of the family like you do. I mean, this is one of the 6 themes that we picked up when we looked at across all the programs, was using children as an educator vehicle, or spreading the word back in their family or beyond their family. And it's a very effective tool. A number of programs have been very, very successful, just utilizing. Again, you're killing, not to use a bad term, but you're killing 2 birds with 1 stone. You're educating the children, right, for their own preventative, and then they're spreading it out to the adult community, kind of a reverse education process. But again, one of the 6 themes that we picked up is an effective approach.
Very good. So financial resources are a challenge, I think, for many nonprofits, all nonprofits. So the question is, how do you maximize the resources that you have, whether working with community partners or through volunteers, as you mentioned? Like, how do you squeeze every bit of value out of the resources that you have?
I think really it's cross-pollination in terms of programming, kind of as we talked about earlier. And just if another nonprofit provider is providing something, we cross-market, we cross-promote, and the leveraging of volunteers. We aren't doing that with our program right now, but I know Lisa obviously is doing it very well. But the Y is a volunteer-driven organization. That's how it started in London in 1844. So I think that might be our next evolution. But really, it comes down to what are the other organizations doing in your community, and what are they doing well, and how can we leverage that to raise up the entire community.
Yeah, that's fantastic.
And I would also say that there are also for-profit organizations that get a tax write-off for helping you. So, for example, for our lab, we as a clinic will pay $4 for a lab that if that uninsured person went and got it themselves, it would be $74. Mm-hmm. And so they're willing to give it to us at cost, and they get a tax write-off for that. And in the process, we're able to serve a whole lot of people who otherwise couldn't afford that $74 just for one metabolic panel. Mm-hmm. And so you can get the for-profit providers in your community to work with you. That's another possibility as well. But When you're serving a community that's hard to reach, often others need to check that off on their list, whether it's a nonprofit or other kinds of organizations, so they often want to work with you, especially when you're out at meetings, you share your gaps. I've found we had a gap, we needed a Zumba instructor who could speak Spanish, and there was a Parks and Rec person there sitting at that meeting and said, I think I can take care of that because I have a new requirement where I need to serve people who have medical issues and are from a low-income community. So I helped her with her requirements by her helping me. So.
You'd mentioned the tax policy. So do you get political support in ways large and small?
And it goes back to our recruitment. We send the list of our events, of our program workshops to our elected officials. They have a list of their constituents, so they send that to them. So they're helping, they're supporting. We have even met with them, and they're providing ideas. Oh, well, let me help you if you need, for us to open up the door to another local agency or anything. So they have been very supportive.
And for me, one of the biggest supports they've provided is they create access. So they'll put me on a committee, or they'll put me in a place where I'll be able to be a voice for the community that we serve, because I've become the appointed person for that meeting or board or committee.
So another topic we wanted to cover is that both of your organizations are working towards expanding to other sites. Any thoughts about opportunities, challenges, anything you can share with the rest of the audience?
Well, I think it's kind of what we shared in our discussion. I think it's finding the right places to expand to, and it starts obviously with leadership and people buying into what we're trying to do. Reaching out to a center or a site and it takes 2 weeks for them to get back to you, it might not be the best partner. So we kind of go through our, this readiness checklist has kind of evolved over time, but making sure that there's a critical mass, it's in an area, in a community that definitely needs it. They're going to partner and work with us. It's not just going to be us doing all the heavy lifting. And they're committed to it. That's kind of some of the things that we kind of find in our, and also they're willing to reserve someplace maybe in their facility for 10 weeks, plus that 3-month follow-up. I mean, that sometimes is a challenge for organizations, and if they can't commit to that, we got to go to the next door and knock. So.
Yeah, our biggest challenge, we have actually 2 opportunities right now where they want us to come and replicate our model in their areas. But the financial commitments, I have a county supervisor who really wants me to come to his area, but they haven't come up with the money. And so it's really tough to do a good job if you don't have some money. 2/3 of our budget, our clinic budget, are donated, but we do need at least that other third to make that match happen.
I think we can cover more topics during the Q's and A's, but Jim, final remarks?
Well, I mean, from a standpoint of looking at it from a perspective of the foundation, both in this session and the earlier session, some of the themes have been very, very strong. I mean, the themes around incentive, the themes around reducing barriers, child care, the themes around the cultural sensitivity, but being more than just a language barrier. It's being part of the community, being that peer-to-peer, that strengthens that relationship. Again, I think that the use of other groups, whether it be children or other groups, to help support your activities is critical, and we heard that throughout the session today. Linking it back to what we're working to accomplish here, I think that any way you can get the information out there. I mean, you've been very, very successful, but I think success breeds success, and the information around your success, other people look at your program and say, hey, we want to partner with you. And I think that just feeds very nicely into what we're trying to do, which is to say, hey, disseminate the information you have whichever way you have, and that in itself will be useful in bringing on other partners and other constituents to help support your mission in a broader way. So, it's very, very reassuring to hear the themes that we're hearing throughout the day here, and the strong, theme around getting the information out there.
Okay, so with that, why don't we open up for any Q's or A's or comments from the audience? Also, if there's anyone that's viewing the session remotely, they can certainly submit their questions via the webinar, which we'll have to address them time allows. Anyone have any questions or comments they'd like to make? Yeah. Wait for the microphone.
Right. Coming from Mississippi, where we have a low-income, tightly family-oriented community, where Sunday dinners are a big thing. All right. So we work with a lot of our patients and we educate them of healthier options with things to be able to bring into those Sunday dinners. But often they tell us if they bring those healthy options, they're not often invited back to the next time. So how can we, or what tips do you have to be able to change the cultural norm to make these healthier options a little more acceptable to these families?
I'll go. So with our Latino population is very similar. They love their tamales, pupusas, very typical foods. So a lot of the things we talk about, not changing. We're not there to completely change. I mean, to take away from that and those foods, but we can do modifications. So instead of or make small changes, like for example, eating whole wheat pasta, and I always tend to hear, oh, but that tastes like cardboard. So I said, how about starting with small steps? Maybe 3/4 regular pasta and maybe 1/4 whole wheat pasta. Also with whole milk. So small changes, baby steps. That's what we recommend to our participants. And as I said, small modifications in their meals. So one of the things that we do at the end of the program, we have a celebration potluck. So in the beginning, I used to say, bring a healthy dish. So everybody brought salad and fruit. So I was like, oh no. So what I did, I said, I want you to bring your favorite dish, what you're known for. The dish that you always take to the parties, but make it a little healthier, but tasty as well. That has been very successful because now the participants are sharing with each other, oh, well, what did you add? It's really good. And they're so proud to share with the group, oh, yes, I changed this, and it's less calories, it's less fat. So those are some of the things that we're doing in our program.
And we are similarly. We have, for example, for Thanksgiving, we had our patients actually bring a healthy Thanksgiving to share with each other, and we had them use the different recipes and things that we had taught them throughout the year. And so they each brought something that they really liked to share with each other, and then share the changes that they had made to it to make it healthy. And also, we have food tasting every week. So whatever fresh fruits and veggies we bring in, we've had them try tofu, we've had them try kale, all these things they've never tried before in their life, and we make it taste good. And so then they're willing to try it and take it home. So part of it's helping people see that it can really taste good, and then they can share that with others.
So we've talked a little bit about the challenges with crackdowns on immigration, and one thing that we've had trouble with, obviously it's an incredibly stress-inducing thing to be so afraid for your family's safety and life in the U.S. And our health coaches have found that they've really needed to kind of put a lot of the education on hold. And so even as they're getting clients access to other resources and mental health support and legal services, they really have to put things on hold and just spend time talking about that. How have you all dealt with that and adapting your program to the realities of 2017?
So during our program, part of the program, we also do a lot of stress management. And it's during that time that participants get to share what are some of their, stresses, what is going on home, what is going on the political platform. And that during that time, all what we do sometimes, yes, we do have to put the program on hold and just listen to them, because that's what they really need at that moment. We also, as part of it, we also provide them some techniques, okay, well, let's think, what can we do? And one of the beautiful things about the program is that they get to share each other, the participants. We're not only there to give them the education, but the participants share with each other some of the things that they're doing to address those issues.
And we also, we are, a lot of things are rumor. So we have someone talk to them before we even start our program about what's real and what's really happening and what's not happening. And we have handouts in Spanish, I know you're right, and all kinds of other things like that. And so we address it so they have some accurate information where they can trust the information. And also we do a lot in stress management as well. So, and I know we started having music before we started our program and get everybody dancing, kind of get them to kind of just forget everything, you know, kind of let go for a little while and focus on themselves and their health.
I think just to also add, you know, we want to meet people where they're at. You know, if we don't ask for a driver's license when they sign up for the program, if they put a different name down or anything, that's okay. I mean, we're just there to help them. I mean, the YMCA is a completely inclusive organization. We just recently removed male-female on our applications. So, you know, we want to meet people where they're at, and we just want to help them.
So our program uses a lot of our patients from our free clinic, which are uninsured or underserved. And we do, we have a lot of undocumented people that come into our clinic, and that's fine, we don't care. But I was wondering, since you have dealt a lot with the Hispanic communities, is there a way, we have had an issue with really, I guess, communicating the importance and the value of a program like this for their health, because, you know, most of them, they're working hard, they're trying to feed their families, and we have an inroads to the other cultures in our area, but for a lot of our Hispanic community, there's always a language barrier. We have people that speak Spanish, but it really, is there a way to really communicate the importance of a program like this to that culture by itself?
So during the first day of the program, we talk about what does the program entail? Because yes, you're right. We see that in our community as well, where they're used to attending maybe one class or two classes, and they think that's it. But we really share the importance of them attending. That is for their own benefit. And one of the things that we do the first day is we provide a program agenda of all the different topics. So we really try to sell the program to them so they're interested. So they even put the incentives that they're going to receive, all the different, even the recipes, the food demonstration, when is the market tour. So they really have a good idea. So that gives them a good idea of the program. But I think most important is to really share the importance, tell them the importance of attending a whole program and why it's 10 weeks, and that is for the benefit of their own health.
And we definitely find your same challenge, but we find with the Latino community, they really care about their family more than their own health. So if you're going to emphasize it's going to help your family, you're going to be around so you can help work and take care of your family, that actually has more strength than saying it's for yourself. And the other thing really, really important we have found is having them to view there's some socioeconomic benefit with them participating, because then they're doing it again for their family. Even if it's a small thing, somehow they can justify it psychologically that, oh, I might get picked for the free gifts at the holiday time, or oh, I'm going to be able to get a backpack for the kids, or whatever it is that you can get other community members to donate to you. That helps them or I'm going to get my fruits and veggies for our family. Something that will help them then come for the good stuff, but that they can psychologically say, I'm helping my family.
For the faith-based organization, because it sounds like you're saying other races or ethnicities are coming in, but for some reason aren't. Like, is there a faith-based component to it? Is it like, I'm Catholic, why would I go to Manitoba?
We're not checking any of that because we're not charging, we're not billing, we don't care. But as far as our we try to convince them you need to do this program with us, because the program, it works in conjunction with the clinic, but the program is also open to the entire community. So even if you don't see our provider, you can still come get your lab work done with us and do the program. So they come in, but you're right, it's about the family component. They'll come in and they'll get, like we had a gentleman in not too long ago, he didn't do the program, but he was getting his medicine. Well, we had prescribed him several medications, cholesterol, hypertensives, whatever. Well, he came back for his follow-up. He got one medicine. And we give samples when we can, so whatever we gave him, he took. And he got that one refilled, but when we told him to get this new cholesterol medication, well, he didn't get it. Yeah, it's not important. And so
it's not important. They can't afford it.
Well, that too, but
we found
right.
that really early. If we didn't provide it, they would not get it.
Right. And when we're rural, we write on the $4. We hand out as many samples as we possibly can. But at the same time, he's thinking, I took off time to come to work here. I'm not taking off extra time to go to the pharmacy again. So
the faith issue you mentioned before we go on is important because our Latino community, you've got Jehovah's, you've got Mormons, you've got evangelicals, not just Catholic anymore. And so if we had any faith component to it, they would not allow their people to come, or they would not feel safe to come. So we have to be completely just there to provide the service, healthcare, what you're there for, not for any faith part, or we missed the whole community of Latinos.
I was just going to ask if there's a family component to your program, and I think just any way you can showcase that, because in the Latino community, they want to do it as a unit, whether going camping or whether it's doing a program. So I think just any way you can emphasize that and create that level of trust, I think is really important.
Thank you.
Thank you.